coming in from literally in the neck to work. Here, sit up. Wait, get up here. I feel like she's.
Oh.
Is it two? Oh, here. Yeah, I need to see you not. Oh, look at her. You know, in the chairs. There, she's getting it. Is the back up? No, up. That way we can see her in. Is that it?
No, this doesn't come up.
It used to. It's going down. No, it's not even doing nothing.
Interesting.
Oh, you know what? No.
Is it this? Here, wait.
Oh. Yeah, I knew that. I missed one button.
There you go, all the way back.
As it goes?
Mm-hmm.
Filming. Sorry.
Okay, so just lean your head back. There you go. Chin down. There. So, she's just wanting this. So I would say, let me come in from this side. Literally coming in from behind the ear. Because you're going to come in from right here to want to pull.
I don't think I'm the best one to record.
So see when you're doing, yeah, so come over here. Look, yeah. Because when we think about it, what we're trying to do, I'm gonna do the driveway is what I'm gonna do. So this is about what she's wanting to pick up, right?
Mm-hmm. Right there.
So right here on either set this one, I don't like this bed.
Okay.
There, yeah, just right there. So see, this is the kind, I'm just trying to make the little pathway of where. So if this is the,
That's the entrance.
and I'm gonna alcohol where I just did my little pathway, my little airline pathway on your cheek.
I mean, if it's sexy, you can keep it.
I don't know if it's sexy or not. If you're sexy and you know it, clap your hands.
Oh, wait, this way, no. So go this way.
That's what I'm kind of, yeah.
So
So,
basically, you're going like this, right? Okay.
right, so then you come in right here and you draw that up. Right? Yeah.
Have you drank any alcohol?
No, it's been about 3-4 days. I've seen that.
Not on any blood thinners?
No.
Okay.
Can't drink alcohol today, though?
No, you shall have.
Yeah, no, you shouldn't.
Are we recording this?
Yeah.
Oh, wow.
Sorry.
All right, so let's attempt to snatch the neck.
Next is my waist.
All right, so do you have a,
I mean, we could take this wig off, but
No,
we
no,
recording.
no.
We gotta do it now. Just like-
I might have
Rubber
one,
band.
yeah, I might have one. Oh, here, we might be able to just stick it.
Just up, yeah.
Yeah, just
Finish
wind
it,
it and
yeah.
stick it. You know what, and I have a headband. Let me put a headband on you. Do I have a big one? I got a big one.
Oh, see? Yeah, that worked. The way my hair set up. Oh, this is different. The way my head is set up, we're gonna go like this.
And then I have a, look, and then I got a bump.
Oh, on it. Okay. Okay, perfect.
But then I could push the wig back a little bit for you.
Thank you, ma'am. Now you look like a lunch lady, right?
I'm about to cook my
What would you like? What would you like your name to be my 6th grade lunch lady right now? What are we gonna call you?
Cookie.
Cook. Oh, you're gonna throw all the little boys off with Cookie.
Okay, Sally then.
No. I like Cookie. I think that's super cute.
Okay, so this one has to be a little longer.
I'm gonna put on
No, just make it.
gloves.
Okay, I'm gonna numb you. Okay.
Hold on 1 second. Let me close my eyes and then we do it.
Do we have a bolster to put? Do you want her? You don't care. You don't. You're doing it. You know which side
what?
to do it. I don't know. A bolster, a head, a pillow. What are you doing?
Woosah.
A woosah.
Yeah. 'cause
Okay.
we got the-
You can lean back and relax.
Oh, yeah, see?
So I'm going to talk to you, right, while she's numbing you. So what she's going to do, I'm going to walk you through the motions, okay? So
just let her do it.
what she's going to do, she's going to just numb you up on this side, and you and I are going to talk about this treatment, okay? So obviously we're going to be using PDO threads on you to tighten up your jaw area. You've seen these before, yes or no?
Definitely gonna be a little down there.
That wasn't too bad.
No, you're doing good.
Oh, you're supposed to feel the sting later.
That's normal.
Okay, just what
You're doing good. You've seen PDO
yeah,
threads
yeah.
before?
No, good.
You have not seen them before? Talk to me. Yes. Yeah.
Okay, we're supposed to be talking. Let me do this part.
Okay, there.
Talk after.
Okay.
Because baby. Okay.
You gonna hold my hand?
I know.
No.
I was holding my breath, I lose weight. Oh gosh. Okay, so the PD threads. There we go.
You've obviously seen them,
Yes.
right? Okay. So, do you know anything about them?
Hopefully after this pain, I'm just like it's not. It's no, but I am hoping that it makes me sexier in the chin area.
Okay. So you're familiar with at least the fact of what we're doing it for?
Yes.
Okay.
Beauty enhancement.
Beauty enhancement, right?
Yes.
So, what we're doing on you are the big cog threads,
Okay.
so that when they bring this on and you're going to get hit with questions from here to there about people, oh, some people say, oh, the threads. Everybody is imagining these really long threads and forgetting that we have the shorter threads too. So the idea with PDO threads is not only for us to pull you back to get a tighter, sharper jawline, or to pull back our skin to make us like a quick facelift or a pull, or to give us a dramatic cat or fox eye, right? There's natural resorts and there's unnatural resorts. It's all based on what you want.
Yeah.
But the smaller threads we can also put in the chin area and the cheek area to build volume, to build our fundamental tissue volume.
So today we're using the thicker ones.
Today we are using
Get that
those
pull.
snatch it, pull you back to try to give you a nice tight jawline underneath. Now, as you saw, I've got these in my face right now, and what you can expect to feel is something. We are putting a thread in there, and that thread, your tissue inside, is kind of like a web, a spider's web. I know, but we're going to put that thread in, and it's going to pull that skin back. So you're going to feel tight. You're going to feel something in there. You're going to feel a little restricted. So I want you to be mindful when you're sleeping. I want you to be mindful when you're talking. I want you to be mindful when you're going to chew something, because you're going to feel different feelings. Tightness is one of them, right?
So do you want me to do like smaller movements?
Yeah, I want you to restrict your movements as much as possible.
Stay on the smoothie, don't worry about it.
Yeah. I want you to just restrict, because what can happen is, one, if somebody just forgets and you're just really aggressive and you go to, do something dramatic, we don't want you going, oh, right?
Yeah.
Your skin will remind you. Your skin will remind you.
Yeah.
Still feel it?
It can take about 2 weeks. You can go ahead and pilot Holer. If you give this 2 weeks for any adjustments, anything that needs to transpire or happen, what adjustments you need.
I have a hot tolerance, so you might as well go ahead and do what you need to do.
I'm
You're
gonna
going to
still
need
wait
2 sessions of numbing.
If we need to make any adjustments, if you get like what I had, which is one of the threads, if you see it kind of protruding from your skin, if you see something hinged or puckered or anything like that, we want to know about it. You're going to be up here. You're going to be able to tell us about it. Well, we don't really want to make any adjustments to the site for about 2 weeks. I want it to settle. I want to see, unless it's something like a buckle, where what is a buckle going to look like? If the skin, if you watch where I pull right here, if the skin gets hinged and you see a
Will
little,
you see a difference the first day?
you're going to see a difference the minute right after she puts it in, she's going to pull it back and it's going to pull your skin up.
Okay.
You see this instantly. This isn't something you have to wait for. For you guys on the smaller threads, when you're doing those for volume or smoothing the skin out, that's instant too. But a lot of that is from the swelling of you infiltrating needles, because the smaller threads act almost like, and they seem almost like acupuncture needles. So when you're putting, 10, 15, 20, 30 of these little acupuncture needles, then you're going to get erythema. You're going to get edema. Much of that will stay. It'll stay when you twist and you pull them out, but some of that is going to go as well. But the idea is that you build the structure of the skin over time first to increase that foundation, and then come back and pull it back. If you need it, that's the time to reassess. So for most people, for her, she's very youthful. She has plenty of volume. She's not lacking volume. I don't need to repair her foundation or to correct, rebuild, anything like that. So for her, this would be about exactly what she's wanting it for. She wants to sculpt the area. So something for her could have been Kybella, which is that fat injection where you go in and it dissolves your body's natural fat over time. Downside of that is it burns, it stings, you bullfrog and bloat out, and not everybody wants to go through that process or have that many sticks with the needle, if you will. And with this, here you go into, it's immediate. It's an immediate result. Now the thread that's being used here, I'm going to show it to the camera. This is the clear thread. And you can see up against this one, it's a blue thread. So the threads that Dr. Jeff uses here are the Lace on Craze threads, and they're the only company that have the clear PCL thread. The difference in the PCL thread is it actually gives you a year or two more longevity life in the skin. So you pay a higher cost, but you also get longer results. So this is the gold standard for your cog, for your lift. If you're concerned with the lift of your non-surgical facelift with the threads to last, then your PCL is your longest living thread. This is the choice you'd want to make. Not that your old blue thread isn't great and everything, but some people want luxury, and by God, that's what we'll give you.
Yes, this is the Chanel to the Michael Kors.
Well, get me out of your way, Miss Kors.
Oh no, this is Chanel.
Oh, Chanel.
This is Chanel.
Baby, this is Alexander McQueen.
Okay.
This is
the top.
well, I don't know. Who else do we want this to be? This is Alexander McQueen. This is Dior. Hi, I'm Louis Vuitton. I did say the other day I was doing a live, and I said some of you out there are still using Mint and PDO, and it's okay that you shop at the dollar store sometimes. But for other people, we want luxury. So something I see people do that I haven't done yet is they actually bend the rod. They actually bend the rod. Some practitioners out in the industry for infiltration, to make things easier, they actually, once you have exposed the rod, once you have got the rod and you go to infiltrate it into the skin, many are bending this rod in different directions to help, so that once they get it in and you push, it goes in the direction that you want it to go. An example of that would be bending the rod as you're going into the side and bending it this way in a U, so that once you get it in and you slide it, it slides in a U shape. They take the cannula and they bend it before insertion, so that when they insert it, it's more customized to the region to get it to the length and the depth of where they want it to get a more accurate pull.
Get in there. Awesome.
That's the fight.
Pop, yeah.
Mhm.
Pop it.
You want me to try?
Mm-hmm. My hole is good size. But get it in there.
Okay, so let's see. Now follow, make sure that you follow your finger in that direction to get it where you want it to go down in there. Nice. How did that feel? All right?
Mm-hmm.
Good, good. You didn't even flinch. Nice. Keep going, keep going. And try to, now this is where the art, now remember when you're in with a cannula and you go in the direction you think you should go, if you go up, it goes down. If you go down, it goes up. So you got to do the opposite, is that you go down and it goes up. Go up so it goes down. And then you want to guide it. Yeah. Yeah. So here you are. You see where you are?
Mm-hmm.
So you're there. I think you're good. Yeah. Then you do skin feed. Doesn't take much for Deborah and I. Deborah and I are like, so as she's, so what Deborah has done, can you, it's a totally different,
Yeah.
okay? So what Deborah has done is she fed the cannula through on the lower neck. She fed it through all the way to the end. She twists to get it to wind and catch onto that skin. She pulls it out. Once she pulls it out, then you pull the skin up onto the thread to get as much of that hold in that skin that you want to hold up onto that thread. And then you'll hear from the thread, you'll hear an actual zip, like a ziplock. And then what we will do is we will sit our patient up, and then we'll be able to compare one side to the other. It already looks lifted just from even the side.
And we'll let you look in the mirror.
Okay, you're gonna be sexy. Hey, now.
So do you see how what this did was this actually
Right
took
here,
away
this, yeah.
this back gel for her, right? So on her in specific, if you got a little crazy and wanted to snatch her up, this is where you notice on this side of her face, she doesn't have that demarcation line, right, in her cheek right up here, right? It's just one cheek. So now we've drawn this up that took away this heaviness here. So it's going to give her more contour, but then if she wanted to, she could come in right there. Right? So then that gives her this, and then look, and then that's where you come up and do the upper right here, and it pulls everything just up. So starting from down here and then working your way up is a great way to stair step people too. Because once you can get through this, you've got trust. You've got trust, right? You build it. And the way you've got to keep this is when they leave, even afterwards, you may have some people that say, wow, this isn't for me. This feels funny, this, that. You can work through that, but I'd always encourage people to give it 2 or 3 weeks before they really make any decisions, because so much is going to happen. And I learned that from my stomach. In 2 weeks, it went from being painful and scary to, oh, I ain't going to like what it did a little bit. Your feelings change. But in the sense that your feelings aren't changing and you're just adamant and you want to reverse this, this is what makes this so much better than a hyaluronic filler. Fillers, you're stuck. You're stuck, and then you've got to go in and dissolve it. There is a cost with that. It does not mean that you will always get it. With this little machine that you have here, radio frequency, all I'd have to do is come in here and hit her a couple of times on even maybe a third of a regular radio frequency protocol, and they're going to go tunk, tunk, tunk. They're going to dissolve, and it's going to let go, and we're going to go back to where we were.